Hi, good day everyone. Welcome to the Drag Queens and Kings show. My name is Alonzo, your host for today. Supposedly there are two of us, but my partner Rona Velarde is currently away, so it's just me for today. Well, anyways, today is an exciting day because I am going to interview someone special via a drug so famous in the respiratory system drug industry. So let's call her right now, shall we?
Hello?
Hello, Profactant Alfa. This is Therese from the Drag Queens and Kings show. Welcome.
Hi, Miss Therese. Thank you for inviting me to your show.
How are you, Profactant Alfa?
I'm perfectly splendid. I'm just having a great time and saving many lives of neonates who are suffering from Respiratory Distress Syndrome.
Wow, that is interesting. Can't wait to know more. Okay, shall we begin? Are you ready?
Yes, I am ready. Let's get it on.
Okay, that's the spirit. So, for the first question, besides your generic name, what are the other names you are known for?
Well, I am a pulmonary surfactant marketed as Cursorf in the United States and Canada.
Ooh, how about your drug classification?
For the therapeutic classification, like I said earlier, I treat neonates with respiratory distress syndrome by replacing the surfactant that is missing in the lungs. Hence, lung surfactant as my pharmacologic classification.
Wow, that is indeed something. I have heard that drugs are categorized according to their effects of pregnant women. What's yours?
Yes, that is true. But I don't have a pregnancy category because clinical studies in women or animals during pregnancy are not available.
Ah, okay, I see. Okay, moving on. What is your mechanism of action in the body, or how do you work in the body?
Okay. Indigenous pulmonary surfactant reduces surface tension at the air-liquid interface of the alveoli during ventilation and stabilizes the alveoli against collapse at resting transpulmonary pressures. A deficiency of indigenous pulmonary surfactant in preterm infants results in respiratory distress syndrome, characterized by poor lung expansion, inadequate gas exchange, and gradual collapse of the lungs. With that being said, I compensate for the deficiency of surfactant and restores surface activity to the lungs of these preterm infants.
Poor babies. So, how does the body respond on you, or what is your pharmacokinetics for that?
Well, I am directed to the site of action in the lungs via endotracheal tube. Sadly, there are no studies performed in humans when distributing and excreting me. But other than that, I am metabolized in the lungs by the normal surfactant metabolic pathways.
May I know what are your indications and contraindications?
Well, again, I am indicated for the rescue treatment of infants who have respiratory distress syndrome and a prophylactic treatment of infants at high risk in developing RDS. Also, I remembered being used in treating adults with RDS and with adults after near drowning. For the contraindications, none, because lung surfactants are used as emergency drugs in newborn.
I also heard that you have side and first effects to the body. Can you tell us more about it?
Yeah, sure. For the side effects, this includes low blood pressure, endotracheal blockage, and low oxygen balance. For the adverse effects in the respiratory are pneumothorax, pulmonary air leak, pulmonary hemorrhage, and apnea. Adverse effects in the cardiovascular are patent ductus arteriosus, bradycardia, intraventricular hemorrhage, hypotension, and for the systemic, this includes sepsis and infection.
Wow, Profactant Alfa, thank you so much for sharing us with those remarkable insights. That level of sophistication you brought to the industry, so helpful in saving lives of countless infants and other people.
Yeah, we all have a purpose in life.
So, I did a little research of my own about the nursing responsibilities when you are being administered. Is it okay if I share it to the viewers?
Yeah, sure. No problem.
Okay.
Fire away.
Such a pleasure. So before you're being administered, such a pleasure. So before you're being administered, the nurse should assess the client by doing a history and examination by assessing the client for possible contraindications and cautions. Second is by performing a physical examination to establish baseline data. Next is to assess the skin temperature and color to evaluate the perfusion. Then monitor respirations, adventitious sounds, endotracheal tube placement and patency, and also monitor the chest movements to evaluate the effectiveness of the drug of you and when you are being delivered in the body. So followed by evaluating blood pressure, pulse, and arterial pressure to monitor the status of the infant, and evaluate blood gases and oxygen saturation to monitor drug effectiveness. And lastly, assessing the temperature and complete blood count to monitor for any signs of sepsis. Did I get that right?
Yes, absolutely. Please continue.
Okay, thank you. So, in identifying the nursing diagnosis, this includes decreased cardiac output related to cardiovascular and respiratory effects of you, risk for injury related to prematurity and risk of infection. Third is ineffective airway clearance related to the possibility of mucus plugs. And lastly, deficient knowledge regarding to drug therapy, which is indicated for parents. And in planning, the nurse should be made aware that the client will receive the best therapeutic effect from the drug therapy and that it will have a limited adverse effects to the drug therapy. And the nurse will also make sure that the significant other of the client or patient will have an understanding of the drug therapy, its adverse effects to anticipate, and measures to relieve discomfort and improve safety. Now, during administering you, the implementation includes patient monitoring, correct endotracheal tube placement, review proper administration of drugs, suction the infant, offer support, and continue other measures. And after you're being administered, the nurse will monitor the client's response to you if there is an improvement in the client's breathing and alveolar expansion, monitor for adverse effects, evaluate the effectiveness of the teaching plan, and support parents as appropriate. And fourth, monitor the effectiveness of the other measures to support and stabilize the patient. And lastly, evaluate the effectiveness of other supportive measures related to the immaturity of the infant. So I guess that ends there. Profactant Alfa, are you still there?
Yep, I'm still here.
So, did I say everything right?
Yeah, absolutely. Everything was on point. Hopefully, our viewers learned something today.
Oh, thank you. Yes, I think our viewers definitely learned something today. Thank you so much for being here with us today, for gracing the show with your presence.
No worries. Thank you also for having me.
Okay, give it up again to Profactant Alfa. Okay, folks, that's it for today's show. Thanks for watching. Stay tuned in our next episode. This is Alonzo from Drag Queens and Kings Show, signing off. Bye.